Assalamu alaikum. I hope you're all doing fine. I'm Dr. Muhammad Ali Rabbani, and today we are going to discuss the osteology of humerus. We will be discussing the bony features, the attachments, and the clinicals related to the humerus bone. So, humerus. This is the bone that is long bone that is present in the arm. The arm in medical terminology is the part from shoulder joint to elbow joint, arm or brachium. This articulates with the scapula above and radius and ulna below with at shoulder and elbow joints respectively. It consists of two ends and a shaft, and the shaft has further three borders and three surfaces. Okay, let us look at the bone closely, and before starting any bone, like any other bone, we will determine its side first so that we can hold it in anatomical position and then go into the detail of it. So, like any other bone, always ask three questions. How do I differentiate between upper and lower end, anterior and posterior aspects, and medial and lateral aspects? Here it is. You pick up a bone from the table, get it in upright position, and first thing is to identify which is the upper and lower end. So this end, which is rounded, this is the upper end, and you can see here downwards this end that is relatively flat from side to side, expanded from side to side, flat from front backwards. This is the lower end. So you have identified your superior and inferior aspects of the bone, so you will get the bone in upright position. The second thing is to identify which is the anterior and which is the posterior aspects. Okay, you can do it from both the upper and the lower ends. I'll start with the upper end. If you see, the upper end has these prominences. This prominence right in front of you is lesser tubercle. This is to be in front of you. This is to be on anterior aspect. So this lesser tubercle should be on the anterior aspect. This is the greater tubercle. This is on the lateral aspect. So this becomes posterior aspect, and if we turn about, this becomes anterior aspect. You can also identify if you are getting confused from the lower end too. In the lower end, you can see the anterior aspect has two foci, this one and this one. So those are present on the anterior aspect. And if we turn around, on the back, there is only one large fossa. So that makes it the posterior aspect. So with this, you have identified which is the anterior aspect of the bone and which is the posterior aspect of the bone. By now, you have identified the upper and lower end, the superior and inferior aspects, and the anterior and posterior aspects. The one that is facing you right now is the anterior aspect. Now comes the medial and lateral. It is relatively easy. You just have to look at the head of the humerus and to see in which direction it is present. So the head is facing the medial direction. So this becomes the medial aspect and this becomes the lateral aspect. Keeping all these considerations in mind, you can figure it out. This one is the bone of the right side of the body. You can repeat the same process by comparing it with the left-sided humerus. With this we are done with the site determination, and we will move on to the bony features. It is a long bone, so naturally it has upper end, it has lower end, and the shaft between that is further divided by three borders into three surfaces. So we will start by describing the features at the upper end. At the upper end, one of the most feature that is seen is the head of the humerus, that is the articulating surface, rounded in shape, about making 1/3 of a sphere, and it is the one that articulates with the glenoid cavity of the scapula. And as you can see, it is directed medially, a little upwards and a little backwards, more prominently seen as you look from the above. So it is directed medially, backwards, and here you see, and upwards. So this is head of the humerus. Then there comes the demarcating line that separates head from the rest of the bone. It is roughly this line, and it will go all the way to the back too. We can draw it here too. This whole line demarcating the boundary between the articulating surface and the non-articulating surface, this is called the anatomical neck of the humerus. Then there comes the tubercles. There are two tubercles, one smaller one facing you. This is the lesser tubercle, and on this side, the whole big one, this is the greater tubercle on the lateral aspect. Let me label it for you. The lesser tubercle, and on the back, this is the greater tubercle. These tubercles give attachment to the muscles, as we will see further. The lesser tubercle gives attachment on its anterior aspect right here, and the greater tubercle gives attachment to the three muscles, one on the superior aspect and two on the posterior aspects. And these can be felt at as small articulating smooth facets, not articulating facets, small facets for attachment of muscles. So these will be visible here, the three facets on the greater tubercle and one on the lesser tubercle. As we will see again in the shaft, these tubercles extend downwards as crests of the same name. The crest of the lesser tubercle and the crest of the greater tubercle. And in between them, there is intertubercular space above, intercrestal space below. More commonly, it is simply known as intertubercular groove rather than a space. I think groove is a better word. This brings us to the surgical neck of the humerus. The surgical neck, the area that is between the head, the upper end, and the shaft below. This part is called surgical neck of the humerus. This part it becomes very clinically important because this is the part usually broken when the upper end is damaged. This is a common side of fracture associated with a nerve injury that we will see by the end of this lecture. So this is the surgical neck of the humerus. Do not confuse it with the anatomical neck that was present between the articulating head and the non-articulating part. With this, we have discussed the upper end in detail. We talked about the head, the anatomical neck, the lesser tubercle, the greater tubercle, the smooth facets on them, the intertubercular and bicipital groove between them, the crest extending down from the tubercles, and the surgical neck. There is also a morphological neck that is actually the place where there was epiphyseal plate, but that is not very easily visible on the adult bone, so we will not be discussing much in detail. The only thing that you need to memorize or remember is that it's almost at the level of surgical neck, a little above it, a few millimeters above it. So this brings us to the shaft of the humerus. Shaft, we will see it has three borders and three surfaces. We will start with the borders. There are three borders: the anterior, the medial, the lateral. Let me change the colors of the bone a little to better highlight those. So here is the anterior border. Anterior border is the one, this one. It starts at the continuation of the crest of greater tubercle or lateral the lateral lip of bicipital groove, and it comes down to the anterior surface, and on the anterior aspect it is not that much prominent, it's just a rounded prominence in the middle of the anterior aspect. And one thing to get to know about this is, as you go in the middle part, it is related to the gluteal, oh sorry, it is related to the deltoid tuberosity as it is shown here. So it is related to the anterior aspect of this deltoid tuberosity. Now, for the lateral border, we will start tracing the lateral border from the lower end, from the lateral supracondylar area. So this is the lateral epicondyle we will see in the lower end. This is the lateral supracondylar ridge, I mean this one, and above it you trace, this is the lateral border. It is the upward continuation of the lateral supracondylar ridge, but as you go up it spirals somewhat back to go to the posterior aspect of the greater tubercle. I think it's a little better to see it here. This is the lateral border going up, and as you see it goes from the back of the this tuberosity, and here you can see a little line, this line going backwards, and this ends up behind the greater tubercle. So this is the lateral border. So that brings us to the medial border. This is the border that is the downward continuation of this greater tubercle, and it spirals outwards and till it reaches the medial supracondylar ridge. So here is the medial border extending from downwards from the lesser tubercle and spiraling medially until it reaches the medial supracondylar ridge right here. So this is medial supracondylar ridge. So these are the three borders: the anterior border, the medial border, and the lateral borders. And between them are the three surfaces. The surface that is between the anterior and medial border is anteromedial border. As you can see from the top, it is basically the making the floor of the bicipital groove or intertubercular sulcus, and as it goes down it spirals away to the medial aspect of the bone. Then between the anterior and the lateral borders here, this is the late anterolateral surface, and the one prominent thing about is that in the middle you saw a tuberosity, the deltoid tuberosity, that was present on the anterolateral surface, with anterior border passing anterior to it and the lateral border passing posterior to it. So this is the anterolateral surface between the anterior and lateral borders. That leaves us with the surface on the back between the lateral and medial surface, that is the posterior surface. And one prominent feature regarding this is the radial groove, obliquely running groove of sulcus on the posterior surface, tracing the pathway of the radial nerve that is highlighted right here. So this is the radial groove. So this brings us to the end of discussion of the three borders and three surfaces of the shaft of the humerus. We talked about the anterior, the medial, and the lateral borders, and enclosing between them were anterolateral, anteromedial, and posterior surfaces. Yes, I would also like to show you the nutrient artery, that is the main artery of a long bone. Most of the long bones have that. So there is an artery, there is an opening here. Now let us start with the discussion of the lower end of the humerus. So this is the lower end of the humerus from the anterior aspect. This lower end form an expanded structure that is expanded from side to side and relatively flattened from in anteroposterior direction called condyle, and it has the articular surface below it that is further divided into two parts. So we'll quickly see them too. And on the medial and lateral aspects of the condyle are epicondyles. And that is the medial epicondyle, and on this aspect there is the lateral epicondyle. And then uh, let's talk about the articulating surfaces. The articulating surface is divided into two parts. On the lateral aspect, this rounded part, this is called, this one on the shown by the green here, this is called capitulum. This is the rounded, goes all the way to the back. And on the medial aspect, the one that is pulley like, that is deep, that is deep from the center and raised from the sides and more raised from the medial side, this is the trochlea, like a pulley. And these two parts articulating with two bones of the upper limb. The humerus is articulating via trochlea with the ulna bone, and with capitulum with the head of the radius. So capitulum is articulating with head of the radius and trochlea is articulating with the trochlear notch on the ulna. And above the trochlea there is a fossa called coronoid fossa because it accommodates the coronoid process of ulna. And above the capitulum it is the radial fossa because it accommodates the radial head. And on the back there is a large fossa in the middle that is called the olecranon fossa because it accommodates the olecranon process of ulna. Olecranon process, and here is the coronary process and head of the radius. One interesting thing to see about trochlea here is that its medial end is extended about a half a centimeter beyond the lateral end. That gives the carrying angle of the arm. By that we mean that if you have arms by your side, your at elbow, the arm is deflected a little laterally. That uh, helps people carry a bucket. That's why called the carrying angle. It is basically the difference in the long axis of the brachium or arm and antebrachium or forearm. That leaves us with the medial epicondyle on the medial aspect. You can feel it in your arm right now if you want to. It is subcutaneous and very prominent. And just above it, the sharp medial border is extended, and this raised part is called medial supracondylar ridge. This is the ridge that is above the medial condyle. And on the opposite end, this one is the lateral epicondyle. This also can be felt very easily, and above it, it is extended as lateral supracondylar ridge. So with this, we come to the end of discussing the bony features of the humerus bone. We started with the side determination, went on discussing the upper end, its parts, then shaft, its borders and surfaces, and the lower ends, its basic features. Of course, when you open the books, you will find more details, but I wanted to go you through the basics. With this, we will move on to the attachments of the bone. We will start looking at the attachments at the upper end. On the upper end, there were two tubercles, the lesser tubercle on the front and greater tubercle on the lateral aspect. We'll start with the greater tubercle. The greater tubercle has one facet on the superior aspect and two facets on the posterior aspects. The one on the superior gives rise to supraspinatus muscle. So this is the muscle that gets attached to the suprascapular fossa, that is all supra, not supra uh, spinatus because it's attached to the upper aspect of spine. and we will see its motions in the subsequent lectures. Then here on the back, the above one, this is the muscle that is the infraspinatus muscle, and this muscle is the one that is attached to the infraspinous fossa of the scapula. Then there comes below it, there comes this one. This is teres minor. Teres minor is the muscle that you will find attached to the lateral border of the scapula. All of the attachments of scapula have already been discussed in the lecture on the attachments of scapula. So there are three: supraspinatus, this supraspinatus, infraspinatus, teres minor, SIT, sit, can be a good mnemonic. And on the anterior aspect, there was lesser tubercle, and there it gives attachment to the muscle that is subscapularis. So this is the muscle that starts from the subscapular fossa and gets attached in the front of the head of the humerus on the lesser tubercle. SITS, you start with the greater tubercle. S means supraspinatus here, then infraspinatus, then teres minor, and on the front there will be subscapularis. After doing the head, we will move a little down, and here you will see the two intertubercular in two crests of the bicipital groove, or two lips of the intertubercle groove, and the floor of the intertubercle groove itself. On the lateral lip of the bicipital groove, or the crest of the greater tubercle, this is the attachment of the pectoralis major muscle. We studied its attachment on the clavicle a little. It's a bilaminar attachment, the muscles are twisting on it, but I'm not going into much detail of that particular topic. Then on the medial lip, there is the teres major. This is the muscle that was originating from the lateral aspect of the scapula, from the lateral border of the scapula, and attaching to the medial lip. And in between them, there was intertubercular groove or sulcus, and that was giving attachment to the latissimus dorsi. It is a large muscle that arises from the lower back, turns around the ribs, and ultimately gets attached to the floor of the intertubercular sulcus after going through a twist. So these are the muscles. So by now we have done 7 muscles, the 3 rotator cuff muscles. The rotator cuff muscles include supraspinatus, infraspinatus, teres minor, and subscapularis in front. Then the 3 muscles that were related to the bicipital groove, one on the lateral lip, pic major, medial lip, that was teres major, and the floor itself. Then comes the muscle that is attached to the deltoid tuberosity. As the name indicates, it's very easy to say that this is attaching to the deltoid tuberosity, will be the deltoid muscle. On the origin, we have already discussed in clavicle and scapula. They were attached there. I'm not going to do the exact bony parts from that. So they were attached to the clavicle and scapula, and there it is attaching here to this part, deltoid tuberosity. And deltoid tuberosity, it's technically a V-shaped insertion due to the multipennate nature of this muscle. Just opposite to it, on the anteromedial aspect, there is an attachment site to the coracobrachialis muscle, the muscle that was running between the coracoid process of scapula and the anteromedial aspect of humerus. Then you will see on the very large attachment on the anterior aspect, that is basically the origin, that is of the brachialis muscle. So that is from the lower half of the anterolateral and anteromedial surfaces. That is the brachialis muscle, and that arises from the lower half of the anterolateral and anteromedial surfaces and going all the way to the ulnar tuberosity, helping in flexion of the elbow. Here, one thing that I will like to mention is that there is a propensity of students to make a mistake of finding biceps brachii on the humerus. Bicep brachii does not attach on the humerus. It starts from the scapula, the short head from the coracoid process, and the long head from the supraglenoid tubercle. So we have done the shaft, and now coming to the lower end. Lower end, there are two muscles arising from the lateral supracondylar crest ridge, and there is a muscle that is arising from the medial supracondylar ridge. The two muscles from the lateral supracondylar ridge, the one that is on the lower part, that is the extensor carpi radialis longus. I know it's a mouthful of name, but we will discuss it in the coming lectures of forearm. This is the muscle that goes all the way down to the wrist and help in extension and abduction of the wrist joint. Then is the muscle that is attaching immediately above it, and that is the brachioradialis muscle that crosses the elbow and goes all the way to insert at radius, and it helps in flexion of the elbow. We will see it again in the forearm. And on the medial supracondylar ridge there, this is giving origin to one of the two heads of the pronator teres muscle. This is the pronator teres muscle that gets inserted into the radius, and it helps pronation of your hand. The pronation is the movement when your upward facing palm rotates upon itself to go to downward facing position. So this is a pronation, so that is made possible due to this. Okay. Now that leaves us with these bunch of muscles. I'm not going into the detail on these, but we will see a common name for this. So there are a number of muscles that are getting attached on the medial epicondyle. So together all of these muscles, they make up the common flexor origin, because these are all the muscles of the make all the muscles of the flexor compartment of the arm. Let me just go through the name. You don't have to memorize them. Flexor carpi radialis, flexor palmaris longus muscle. There is flexor digitorum superficialis muscle, flexor carpi ulnaris muscle. So all of these muscles are making the flexor compartment of forearm. And here there is a number of muscles, and these are, you don't have to again memorize the name. This one, extensor carpi ulnaris, extensor digiti minimi, supinator, extensor digitorum, and extensor carpi radialis brevis. All of these muscles are together called common extensor origin. And there is this muscle that is not considered a part of common extensor origin. This is the anconeus muscle. This is the anconeus muscle that goes down to get attached to the ulna, and it has a role in extension of the elbow joint. Now this leaves us with the last muscle on the dorsal aspect, on the posterior aspect of the shaft of humerus. This you might have guessed it again. This is the triceps muscle. It's two heads. The one that is the area, the white area between them is the radial groove. The one that is below the radial groove is the medial head of triceps, and the one that is above the radial groove, above and lateral to the medial radial groove, this is the lateral head of the tricep muscle. So these are the three heads of the triceps, two originating from humerus, the medial and lateral head. Medial head is hidden now, and then there is a long head that is getting attached to the scapula. So this is all about the muscles attachment on the humerus. There are not many ligamentous attachment to be discussed here, but there is attachment of the capsule of both the joints at both ends. There is a capsular attachment on the shoulder joint that is attached to the margins of the articulating surface. In other words, that was the anatomical neck. But on the medial aspect, it does not follow the contour of the anatomical neck but dips down a little before going up. So this is a part where the non-articulating surface of the bone is included in the capsule. Otherwise, it follows the same pattern on the other part. As you go up, bring the bone up and see the lower end, it follows more or less the same pattern. And here the fossae, and the radial fossa and the coronoid fossa, these are included in the line. So the line of capsule goes above it, and the epicondyles are outside, so it goes through here. and again the olecranon fossa is included in the capsule, and again lateral epicondyle is excluded. So this is how the line of attachment of the shoulder joint and radial joint goes. So this brings us to the end of the discussion of the bony features. We discussed the parts of the upper end, the lower end in the shafted details, and we discussed all the attachments that are on the humerus bone. And I'm adding in this video the pictures from Netter's Atlas. You can pause the video here and go through these yourself, or better yet, buy and go through the Netter's Atlas. That's a wonderful go-to book for anatomy from the anterior and posterior aspects. Again, I'm not going to go through this picture, and you can pause the videos and go through these. Here is the clinical aspect I wanted to discuss. The humerus is related to three, or rather four major nerves, three nerves very intimately. Here, near the surgical neck of the humerus, the axillary nerve crosses just posterior to it. And in the shaft, just behind the shaft of the humerus, the radial nerve crosses through the radial groove and put in place there between the two heads of triceps, the lateral and medial. And just behind the medial epicondyle passes the ulnar nerve. So all these three nerves are vulnerable to injury in the case of fracture of surgical neck of humerus, shaft of humerus, and medial epicondyle of humerus respectively. Here is another picture from the BD choracea. In the case, the humerus is fractured just above the condyle and the proximal or superior end moves forward. In this case, the structures that are present in front of it in the cubital fossa may get damaged, and mostly the affected part is brachial artery. So this may be damaged, and in the case of severe movement of the severe dislocation of the supracondylar fracture, the proximal segment, the median nerve may be involved, but that is rarely the case. Thank you so much for listening. I hope it had been useful for you. So, if you have any questions, suggestions, or feedback, please do mention in the comment below, and you can reach us with any of the social media handles that are mentioned here. Thank you so much for listening. Inshallah, see you in the next lecture.